Hi, I'm Colleen. I'll be giving your shift report today for Ethel Williams. She's a 92-year-old female. She presented to the emergency department last night with her husband because he had concerns that she was acting drunk despite um abstaining from alcohol due to religious reasons. She was acting drunk after leaving a restaurant after their anniversary dinner. She's presented with slurred speech, drowsiness, and confusion. She was ANO times two, disoriented to time and event, and she's now complaining of abdominal pain and headache. She has a history of type 2 diabetes, cirrhosis, and hypertension. She's a practicing Mormon and attends church every Sunday and lives at home with her husband. She takes metformin and metoprolol. And currently, we have concerns for auto brewery syndrome. Um, Her vital signs are as follows: 130 over 90, heart rate 110, um, abdominal pain 4 out of 10, respiratory rate 20, temperature 98.6, and SpO2 98% room air.
Do you have any questions? If so, pause the video and think about them.
I do.
Yes, Ellen.
Has she experienced these symptoms before?
No, she has not. This is her first time.
What did she eat at the restaurant?
She had a high carb meal. She had pasta, bread, and dessert.
What is her pain assessment now?
It's currently a 4 out of 10, worsened slightly after eating, and she's describing it as dull and crampy.
Okay. What's her baseline mental status and what's like her most recent mental status assessment?
She's normally alert and oriented times 4 according to her husband. She's independent with her ADLs. I know that's a concern since she's a little bit older. And she's cognitively intact for her age. Right now, she is still alert and oriented times 2, and she's disoriented to time and event.
What is her blood alcohol level?
Her current BAC upon admission was 0.18%, despite denying any alcohol intake.
Okay. And what are her orders now from the doctor?
So these are her current orders. She has a no-carb diet. She needs to monitor her BAC level. The provider put in an order to do that another BAC test, stool test, a carbohydrate challenge, and an endoscopy. She also takes metformin and metoprolol at home, so those medications are still there, and then she also has an order for IV fluids. So from shift report on Miss Ethel Williams, we gather that she's a 92-year-old female. She's a little confused, disoriented right now. She's a little tachycardic. Everything else seems relatively normal. She has a history of type 2 diabetes, cirrhosis, hypertension, and she does not drink due to religious preferences. How do you guys interpret these results?
I'm thinking that she could be a risk for fall because of her mental status. She's a little confused, drowsy, and she's 92 years old. What do you think?
I think it could be a risk for a UTI because of her age, and she's confused, her orientation, and her heart rate is a little high.
Yeah. Her mental status is also concerning to me because she's acting drunk, slurred speech, drowsiness, confusion. Do you have anything else?
I also think it could be a risk of dehydration or an electrolyte imbalance because of her confusion, abdominal pain, and her blood pressure is a little high and her heart rate is high.
I think she could also be a risk for auto brewery syndrome because she's Mormon, so she doesn't drink, and she's been acting drunk and confused, and she just had a really high carbohydrate meal according to her husband, and she's a type 2 diabetic and has cirrhosis, which are both risk factors.
Yeah. All right, so based on your interpretations, what do you guys want to do?
I think the main priority is to check her current vital signs and to do a mental status exam.
Yeah, I agree. And then we should also, just while we're in there, get a CBC check her blood alcohol content and blood glucose level, and then also check for a UTI, like we were mentioning before, and a stool test to see if there's some yeast in her stool. And then we're sending her down for an endoscopy to test for her auto brewery syndrome. Hi, Ethel, I'm Colleen. I'll be your nurse today. Is it okay if I take your vital signs?
That's okay.
I also have a few questions for you that might seem a little silly.
All right.
What's your name?
Ethel Williams,
Ethel Williams, nice to meet you. Do you know where you are right now?
Endicott Hospital.
And what day of the week is it?
It's a Wednesday.
Perfect. And do you know why you're here today?
I'm not really sure. I'm a little dizzy and my stomach hurts, so I think that's why.
Do you remember coming into the hospital last night?
I don't. I know that I was at dinner with my husband, but I don't know when I got here.
Okay. Well, I'm just gonna collect a urine, blood, and stool sample, and then I'll be right back, okay?
Okay.
Okay, so the results of those assessments came in. Our CBC is normal. Our BAC has dropped to 0.09%. Our blood glucose level is a little high at 140. Her urine sample is negative for a UTI, and her stool sample is positive for yeast.
Okay, Ethel, we're gonna bring you down for the endoscopy now, okay?
Okay.
Ethel, how did your endoscopy go?
I'm not feeling too good after it.
Oh no, I'm sorry. What's going on?
My stomach really hurts and I have the chills.
Oh,
Very cold.
can you describe that pain for me?
It's really sharp, pretty intense.
Yeah, can you rate it on a scale of 1 to 10?
It's about a 6 right now.
6, okay. I'm gonna double check your vital signs just to double check everything, okay?
Okay.
All right, so this is what we're noticing. The client came back from an endoscopy, and she has pale, cool, clammy skin. Her blood pressure is currently 92/64. Her heart rate is 150. Her respiratory rate is 24. She's 95% on room air. Her temperature is 99.5. She told us that she has 6 out of 10 abdominal pain, pretty sharp right now. And she did just use the bathroom, and it was a dark colored stool. All right, so after getting this data, what do you want to do?
I think that we should get a CBC, hemoglobin, and hematocrit because she might have some internal bleeding from the endoscopy, and we want to check those levels to see if it's low. A fecal occult test because she had black tarry stools, like you said. Apply oxygen because it sounds like she might be in some kind of shock. And the semi-Fowler's position because it might help with her blood pressure.
Yeah, these were great things to do. What else might we want to do while we're at it?
I think we should contact the provider because it seems like an emergency.
Yeah, that's a good option.
Hi, I'm calling about my patient Ethel Williams. She's a 92-year-old female that just came back from an endoscopy for suspected auto brewery syndrome and is experiencing increased abdominal pain, chills, and tarry stool. She presented to the ED last night acting drunk with slurred speech, drowsiness, and confusion despite not consuming alcohol. Her blood alcohol content was 0.18% on admission, but has since dropped to 0.09%. A fecal test indicated the presence of yeast, an indicator for auto brewery syndrome, so she was sent for an endoscopy for further evidence. After returning from her endoscopy, her vital signs become unstable as following. Blood pressure was 92/64, heart rate was 150 beats per minute, respiratory rate 24, O2 sat 95% room air, and her temperature was 99.5 degrees Fahrenheit, and she has 6 out of 10 sharp abdominal pain. We recommend a CBC, H&H, and to test for internal bleeding. Please come down to see Mrs. Williams because I'm concerned she will need IV fluids or blood products due to a potential GI bleed.